Good afternoon, everyone. Welcome to today's session, Looking Ahead, Ohio's Gambling Survey in a Brave New World. I'm Derek Longmire, PGNO Executive Director, and supporting me today is Michael Bizzelli, PGNO Associate Director. Stacy Frohnapfel-Hassan is our presenter for today, and will provide you some background and information related to all things gambling's data related, as well as something to look forward into the future. Just some housekeeping things before we get started today. This session will be recorded and will be made available on the PGNO YouTube channel within 48 hours of the recording. Handouts will also be available, and I will include those in the follow-up email to be sent out. At the conclusion of the survey, you will be prompted to complete, at the completion of the session today, you will be prompted to complete a survey. And if for some reason you missed that, then it's also going to come to your email in the follow-up go to webinar email that's going to happen an hour after our close. Certificates have been applied for through both the Ohio Chemical Dependency Professionals Board and the Social Work, Job, or Family Marriage Therapist, and whatever that board is. We have not yet received approval for those, so as soon as we do get notification, I will send those out. I understand that with everybody working remotely, that there's been some delays in processing that. The last thing before we get started, want to familiarize yourself with the GoToWebinar control panel. You'll have options for submitting questions, and you can do that in the question section of the control panel. And you can also participate in poll questions. If you are viewing this in full screen mode, you may not be able to see the poll questions, so you may need to minimize the view of the PowerPoint presentation in order to participate in the polls. So we're going to do a little poll question right now, and I'll go ahead and launch that. The first poll question is, what did you do for Memorial Day? And you can select all of the following: slept in, had a cookout, spent time with family and friends, or did yard work. Just take a few moments and just say what you did for celebrating Memorial Day. This is just a way to test this, just to familiarize everybody with the features of GoToWebinar. Give you 5 more seconds to answer. And it looks like the majority of you spent time with family and friends. Wonderful, 82%. We also had 46, almost half, did a cookout. And then we've got 39% slept in and did yard work. So hopefully this was some much needed rest and relaxation as we look forward to really closing out the fiscal year. This is always that last holiday in before we get the fiscal year moving. So with that, thank you for your participation. As you had those questions, be sure to drop those in the question section of your GoToWebinar navigation panel. And I will kick things over to Stacy Frohnapfel-Hassan to do a little introduction about herself and get us moving.
Thank you, Derek. And thank you for giving me the opportunity to share this information with the folks that we have on the webinar. I have been in public service for a long time. I'll just say that. I guess about 20 years. And prior to my role now, and my current role is Chief of Prevention for the Department of Mental Health and Addiction Services, and also Chief for Problem Gambling Services. Prior to that, I was actually with the Department of Alcohol and Drug Addiction Services when it was still a standalone department. And there I was over communications and workforce development. Definitely policy work and a lot of outreach and advocacy, public education. What we do from a data perspective for the purposes of today's presentation feeds into everything that we do. The problem gambling work is, of course, the full continuum of care. It's promotion and education and prevention and identification, screening and treatment. It is recovery. It is everything along the full spectrum. The quote that you see, words are important. If you want to care for something, you call it a flower. If you want to kill something, you call it a weed. And that's by a gentleman named Don Coyce. I love that quote. I use it at different times, mainly because of what it's saying about stigma reduction. And having a couple decades in the behavioral health world, I think that stigma is one of the most damaging issues that we deal with. We have a lot of, obviously, behavioral health and physical health consequences related to the clients that we serve. And for all of them, stigma is one of the most serious consequences. And I used to think that addiction carried more stigma than anything else, but I would say my eyes have been opened over the years to the fact that there's certainly a lot of stigma around mental illness and an extremely lot of stigma around gambling addiction, gambling disorder. It's become, over time, simpler for people to understand that when you put something in your body, a chemical in your body, that it can change the way you think and the way you behave, the way you act. But with gambling addiction, the general community just doesn't, they just don't get that. Even though a brain scan can show segments of the brain lighting up, just like when someone is using cocaine, generally we don't have that kind of public education opportunity with most folks. So I just like to include this quote because everything that we do is translated. It's translated into words, for sure, into images, and it's translated by those individuals that we are sharing it with in terms of public education. So please keep that in mind and be your own best advocate for what you do as a professional, as a community member, as a person in recovery, and for how you talk about the work that you do and the individuals that you serve. Oh, there it goes. Derek, are you advancing or am I? Okay.
You're able to if you'd like.
Okay. I'll probably let you do it because something else is moving instead of the screen when I advance. We would like to do one more poll at this point, and just so I know with whom I'm speaking. Are you a certified prevention professional, a clinician, a person in recovery, an administrator, or a community member just curious and wanting to learn more about gambling issues? And let's do the poll now, please. And you certainly may be more than one of those. Select all that apply.
And that poll should be on your screen right now. Just take a few moments and answer which apply to you.
Okay. All right. Prevention folks, administrators, clinicians, just 36%, a little bit less than prevention. This is a good mix of folks. I appreciate the 8% indicated in recovery. I appreciate you all, actually. All right, thank you. Okay, let's see, advancing. All right, go back one. Thank you. Still think it's you. These are shortened, but these are today's objectives, just so that you know what we're shooting for. An overview of our 2017 Ohio Gambling Survey. We will look at youth data, and I have the latest from the Southwest Ohio, the Hamilton County, 40,000 young people who were surveyed around gambling in 2019. We'll talk about how the data has been used, how it's been translated into different strategies within the communities, and then we'll have some discussion about data and methods as we start to plan for the 2022 survey. And next slide. Next slide. Okay. So in case you weren't aware, we did a survey in 2012. That survey was of just 3,600 Ohioans, and it also gave us statewide data in terms of gambling prevalence, and it also gave us what we called cluster data. So Columbus, for example, was in a cluster with contiguous counties around Franklin County. Cuyahoga, a cluster with contiguous counties around Cuyahoga, and so on. So we had a sense of what the gambling prevalence was like in each of those areas around the state, as well as statewide numbers. We'll get into those numbers in a minute. What I wanted to just make sure that everybody had a similar understanding of is what we were actually looking at in terms of prevalence. We use the Canadian Problem Gambling Index, and on that index, if you endorsed 1 to 2 of the items, you're considered a low-risk gambler. That means you're already at risk of problem gambling, but at a low level. The moderate risk folks scored 3 to 7. They endorsed 3 to 7 of the items on that index. And someone who was considered a problem gambler and would probably be diagnosed with gambling disorder would score an 8 or higher. So that's a significant endorsement of the items on the CPGI. Next slide, please. Thank you. Back one. Okay. All right. So what we saw in 2012 was that we had 5.7% of adult Ohioans at risk for problem gambling. 5.7%. When we redid the survey in 2017, that 5.7% doubled to 10.3%. I should say nearly doubled, but almost exactly doubled. So 5.7 to 10.3%. 1 out of every 10 Ohioans at risk for problem gambling. When you look at those that would probably be diagnosable with gambling disorder, that number more than doubled. It was 0.4% in 2012, 0.4, and it doubled to 0.9. So we were at almost 1% of individuals who would probably be diagnosable with gambling disorder. If you look at that 4th bullet there, why did this happen? Well, our best summations, I guess, assumptions are in that 4th bullet. Since 2012, the casinos and racinos opened. We know that's a factor. We know that individuals who live within a 50-mile radius of casinos and racinos may have increased gambling and may have increased problem gambling. Sports gambling grew. It grew in many different ways. We had DraftKings and FanDuel completely saturate the market in those 5 years in terms of being able to play those games on computers at home, on individuals' phones, I mean, primarily on phones, and literally everybody had a cell phone. Everybody had access to 24/7 gambling at that point. Normalization of gambling occurred during that time, and we'll talk more about how that is happening more and more over time. And the process for normalization, most of the folks on the call have been in the behavioral health world. We know that normalization is something that plagues is the word that comes to mind It might be too strong a word, but it is what we see and what we can anticipate when we look at alcohol use, at drug use, especially marijuana. You have parts of the world where what we consider illicit drugs are legal, and gambling has become one of those potentially addictive issues that is being normalized because it's being promoted with very young children. Next slide, please. So how many Ohioans is that? It's a great big number. 919,000, almost 1 million Ohioans at risk for problem gambling. Why is it such a giant number on your screen? It's because it's a great big number. I really wanted to hit that home. When we first started, the focus from ODATAS and then Ohio MHAS on problem gambling, it wasn't the beginning of Ohio's work around problem gambling. We had the Ohio Lottery Commission also working on prevention of problem gambling and promotion of responsible gambling since 2002. But once the casinos opened, we started to organize it more through mental health and addiction services and our partnership, Ohio for Responsible Gambling, that includes Casino Control Commission as well. So we are looking at almost 1 million Ohioans at this point at risk for problem gambling, and less than a tenth of that, little less than a tenth of that being potentially diagnosable. When we look at where we came from in terms of problem gambling, and a lot of you would remember this, I would think, nobody cared. Nobody paid any attention to the issue of problem gambling, to gambling disorder. We knew it was a small amount in 2012. Before that, it wasn't necessarily even quantifiable, which is why when we did the survey again in 2017, we did 50 separate reports so that every board area would have its own data set. And we'll talk about that a little bit more. But that was done, first of all, at great cost in terms of all kinds of resources, but mainly because we wanted folks to take notice. It was about advocacy, it was about stigma reduction, and it was about this great big number in front of you. Next slide, please. Another big number. So this was the 0.9%. Less than 100,000, but it's, it was creeping up there. It more than doubled again, as I said, since 2012. This many people could benefit from treatment for gambling disorder. That's an awful lot of adult Ohioans. And the vast majority of them, as many of you know, have other co-occurring issues. They may have physical health disorders, physical health illness, other behavioral health disorders. In fact, it's much less likely that gambling disorder is the only issue that they would hopefully deal with. We know that we're seeing just a tiny fraction of these individuals within treatment. Next slide. So here you see one of our, we just call them comparison graphs. And I know it's a little hard to see the counties, so I was just going to tell you what some of those were. This is in order of at-risk problem gambling levels across the state. What you see as number one is Mahoning. Mahoning had the highest level. 15% of individuals at risk were problem gambling qualified based on that CPGI survey. Then Cuyahoga, Jefferson, Lorain, Trumbull, Hamilton, Columbiana, Lucas, Summit, and Portage. if you think about where most of these counties are, let me run that through one more time. Mahoning, Cuyahoga, Jefferson, Lorain, Trumbull, Hamilton's an outlier, Columbiana, Lucas is a little bit of an outlier, Summit, Portage. There's a couple assumptions you can make based on where these numbers are, where the counties are. The main assumption, if we had these mapped, would be we're looking at the northeast quadrant. Northeast and around the corner of the state down towards Jefferson County, which would be considered more east to north. Cuyahoga and Lorain, I mean, that whole corner is in the highest parts of the at-risk problem gambling among the state. And then we have Lucas and Hamilton. And there's an assumption there, Lucas and Hamilton. Both of those counties had a lot of gambling prior to casinos and racinos coming in 2013. They were both border counties, Lucas being close to Michigan, where there was plenty of gambling available, especially in the Windsor area, and Hamilton next to Kentucky, where gambling was available. And now, of course, there's more next door in Indiana. Looking at the next slide. Thank you. So here's another quick look at at-risk problem gambling among the youngest of our cohorts in the state, 18 to 24-year-olds. And as we look at ages and at-risk problem gambling, 18 to 24-year-olds, regardless of the county, with very few exceptions, is the highest group. Some county, when we look at county to county data, sometimes they're pretty close when you go across the age spans. But in general, this is where you see the biggest breakdown. The first one up there is Belmont, Harrison, and Monroe. I'm from Belmont County, grew up there. It's an Appalachian area. We always said there wasn't a lot to do, but one thing that was always there was the dog track. Plenty of cultural gambling, I'll just call it that. It was based on religion. It was based on our various cultures. There was a lot of gambling. Under Belmont, Harrison, Monroe, for these 18 to 24-year-olds, Ashland, Trumbull, Richland, Allen, Auglaize, Hardin, Lorain, Lucas, Gallia, Jackson, Meigs. I'll just stop it there. On this list, Mahoning is number 10, even though they were number 1 in the state. So what we see probably is a leveling of at-risk problem gambling in the Mahoning area. I show you this because it brings great concern. That 10.3% is the red line for the state of Ohio. Everybody above that obviously is higher than that. Below that is lower, but that does not mean that it's to be ignored. We really need to focus so that we don't move more people into that gambling disorder state. Next slide. Another element of the data, which is frankly fascinating and certainly calls for a lot of attention, is race, ethnicity, and gambling behavior. In the first column, you see the white Caucasian individuals, almost 9% are at-risk problem gamblers. The next column is African Americans, 19% at-risk problem gamblers. And remember, these are state averages. Other race, which is a combination of it's Native American, it's Asian, Pacific Islander. Those are the biggest groups in other race, 12%, and those of Hispanic ethnicity at almost 15%. So this is extremely relative depending on your county. If you have a high African American population and you're thinking about prevention and outreach, then you should definitely be thinking about how to reach the African American population. Highest Hispanic ethnicity. Again, please take note of this. And as I mentioned earlier, the county-specific data sets are available. If you haven't seen them, we'd be happy to share them with you so that you can see how all of this data is relevant to Trumbull County, for example, or Tuscarawas and Carroll counties. It's broken down by board areas. And again, it depends on the census makeup of your board area. Depending on where you are in the state, there may be a high concentration of that other race category, Asian Pacific Islanders. It shows 12% here, but we saw much higher levels depending on where, which, the census levels in different counties. So this is letting us know the folks that we should be seeing, the clients that we should be seeing in our treatment programs should reflect this breakdown. Instead, are you seeing almost all white people? And is that relevant based on the census breakdown for your board area? It's good to be familiar with that, and you don't have to look up census numbers. You can look at your board area's data set because every single one was weighted for the census in your area. So if it's a particularly high level population of African Americans, then the responses to the survey were weighted to reflect that, for example. We also know that from research, it takes about 3 to 7 years before you, if you're a gambler, before you might start to see more serious consequences. And that is for those people that are moving along the problem gambling spectrum. That is a guideline. It's not necessarily a rule. For some, gambling addiction can be like any other addiction, where the first time you do it, it has a lot of appeal. It causes that giant dopamine rush, and your brain thinks, well, this was great. This was awesome. I want to do this again. The sooner the better. And the more I do it, the better I'm going to feel. All of those things that come with any other addiction can and do, for some people, come with gambling. So whether that euphoria is coming from cocaine, for example, or it's coming from gambling, it may feel the same for the individual. And let's move on to the next slide. Because we're talking about cultural, ethnic groups, we have this comparison slide for African Americans specifically. And we didn't do this unless there was a significant African American population within a county board area. So here you can see Crawford Marion at 37.5% of the African American adults had at-risk problem gambling, more than 1 out of 3. It's extremely high. It's definitely something to take note in that board area. Jefferson, 28%. Again, very high. A little bit further down, we see Richland, Stark, Erie, Ottawa, Lorain, Paint Valley, and so on. There are a number of board areas higher than the state average of 19%, as I mentioned earlier. So please think about that when you think about how you're doing your public education, your outreach, your client engagement. Next slide. We won't go through our whole slide deck in terms of the survey data today. I just wanted to get some representation so that you could see what all we have, and we can talk about some of it in more general terms. So in general, the individuals with the higher rates of at-risk and problem gambling were underemployed. And underemployed meaning they were unemployed, or they were part-time employed, or they may have been disabled and therefore not employed, although disabled individuals often work full-time. But in general, what we see with our data is that folks are underemployed in the at-risk problem gambling levels. Poor relationship status. I actually went back and forth on whether the word poor applied. I guess I should just say relationship status. Poor seems to be my own opinion. So let's mentally make this relationship status. I'm debating the point because it was individuals who were separated, divorced, and single in general, where relationship status was a factor in at-risk problem gambling. So for a lot of folks, those relationship statuses might be excellent. It depends on your point of view. But the bottom line is divorces and separations and individuals living single, those folks did have higher at-risk problem gambling levels. Less education. High school education or less, we saw higher rates of at-risk problem gambling. Individuals with just some technical college skill, some technical college courses, but not a degree from a tech school. So the lower levels of education, higher levels of problem gambling we saw. And then those last two flags there, family history of alcohol and other drug addiction, and a family history of gambling. Those were definitely predictors of someone having at-risk or problem gambling issues for themselves when it was there in their family members. And family history of depression and stress. Again, those genetic factors can translate. Is it genetic? Is it environmental? It's probably a little bit of both, and that's true for all other addiction issues as well. So those are the main flags when we talk about societal and genetic factors among the individuals that received the Ohio Gambling Survey and were counted. And let's advance the slides. So the health consequences, certainly alcohol, drug use, tobacco, nicotine dependence. Just that one at the very top can already cause great havoc for an individual's health. We know that. Depression and anxiety from a mental health status. Is the gambler medicating for depression or anxiety? It's very possible. Chronic pain. We know that some people, especially older adults, will gamble so that they can forget about their chronic pain. While they're in the action of gambling, they don't feel those aches and pains they might feel when they're up doing something else. Their mind just focuses on the gambling activity. Higher rates of bipolar disorder. Let's talk about the rates a little bit. Jumping back up to substance abuse, including nicotine, problem gambler is 7 times more likely to be experiencing substance abuse, including tobacco. In a research study, 76%, 3/4 of a gambling addiction treatment group suffered from depression. Between 16 and 40% suffered from lifetime anxiety. Very high numbers, and we saw those same correlations with our data. Bipolar disorder, 1 out of 5 individuals I'm sorry, that's actually 1 out of 4 individuals with disordered gambling also have bipolar disorder at some point in their lives. Suicide, ideation, and attempts, very high among this population. We'll talk about that a little bit more. In general, though, 32% of our folks with gambling disorder have attempted suicide, almost 1 out of 3. It's the highest, it's the most prominent reason for attempting suicide after major depression. When we shared this information with the medical director at Ohio Mental Health and Addiction Services, excuse me, he was extremely taken aback. He said, "I have no idea." That's fine. We understand that. That's why we're talking. And we were able to have him get an article in the Ohio State Medical Society's publication that goes to physicians around the state to help physicians in general understand that gambling disorder, first of all, it's a serious issue. And second of all, it is not a standalone issue. It's rarely a standalone issue. In addition to what you see here on these flags, there are things like diabetes and heart disease and obesity and a number of other, certainly high blood pressure, a number of other, what the medical field calls comorbid issues that can come with gambling. Someone will go into a doctor's office and be there maybe because of weight gain, maybe because of high blood pressure. He or she may have developed diabetes because of the weight and so on. And it's very likely that a physician would never ask, well, what are you doing in your free time? Usually they say, how much exercise do you get? Well, if someone answers that question, they're not responding to a question about gambling. It's highly unlikely that they're going to say, I don't exercise, I spend all my time gambling. Or I gamble in all the free time I can get. Because there's stigma to that. So whenever you have the opportunity, please educate the medical community in your areas. It's extremely important that a physician consider problem gambling as they're considering other health consequences. And intimate partner violence, we might not think about that, but when you have a spouse or another partner that is gambling to excess, gambling where it becomes a problem for the relationship, for the family, you can have very high rates of intimate partner violence. Excuse me. Of women seen in an emergency department in the ER for domestic violence, they're 10 times more likely to show up for domestic violence if the partner was a problem gambler. 10 times more likely. 50 times more likely to show up in an ED if the partner was a problem gambler and a problem drinker. Think about that. 10 times more likely if it's a problem gambler, the partner, 50 times if it's a problem gambler who also is a problem drinker. One wouldn't have to look very far for a reason if that is what's happening within the relationship. Next slide, please. Okay, so that leads us into this particular comparison. And again, I know you can't see the fine detail, but you can see the two colors. And here we have alcohol drug use while gambling. We also have one of these charts, which we won't look at today, that is showing intoxication while gambling. This one is just, now remember, these are self-reported. So someone got a call to take the Ohio Gambling Survey and was willing to say, yes, I drink while I gamble. Belmont, Harrison, Monroe, which, if you recall, was also where we had the highest level of 18 to 24-year-old at-risk gamblers. It's also the highest level of individuals drinking while gambling. And not a big surprise, Belmont, Harrison, Monroe is also at the top of the chart for gambling while intoxicated. Under that, we have Hancock, Crawford, Marion, Mercer, Van Wert, Paulding, Washington, Putnam, Portage, Huron, Franklin. The vast majority of these top 10 county board areas have something in common. They are rural. They may have some city centers, but they're mostly rural. So what does that mean in the big picture? I mentioned it earlier, there might not be other things to do, depending on a person's perspective. There's always something else to do. But in these areas, it might be a little bit more far-flung to find other activities, especially if you want to do it while you're drinking. Next slide, please. So I put this together just to get kind of a bird's eye view from around the state. This is more like what we did with our cluster data in 2012. But this is based on the 2017 data. So I'm not going to read all of these. But if you look at those areas that are northeast and northwest, for example, both have high to moderately high rates. They're both border areas, as is down in southwest in the Hamilton County area. And those were high to start with. They were high back in 2012. They're still high as expected in 2017. Most of these areas had noticeable higher rates among African Americans, and you see Hispanics in the Cuyahoga County cluster area, higher rates among Hispanics and Asian Americans, which shows up in that other category. Unless an area had significant higher Hispanic and Asian American populations, we weren't able to break that out. So we didn't actually put that in a comparison chart. I'd also like to point out that the light blue piece indicates women with higher rates, higher problem rates than men. And that definitely seemed to be a function of rural counties, rural board areas and rural counties, when you saw higher rates among women over men. You also might see higher rates of retired, unemployed, and possibly disabled individuals in some of the rural areas. Next slide, please. So this slide is looking at what kinds of gambling individuals are doing. Problem gambling by type of gambling. The number one is sports, and that was just about 0.5% higher than casinos, racinos. So sports was about 24.5%. So one out of four problem gamblers was gambling in sports, whether that was online, whether it was sports pools at work. Obviously, there are a lot of ways to gamble on sports these days. Casinos, racinos was right at 24%. They're also very popular, and potentially at-risk problem gambling. Lottery at 15%. Other is a fairly big category. About 15% of people were in that other category in terms of at-risk problem gambling. That included internet cafes, other online kinds of gambling, card games, dice, the kinds of gambling you might do at home or with friends. And then stock market was at 14%. And that has become a newer phenomena. You have individuals who make their living that way. We don't know for sure what kind of living they're making, quote unquote, but we do know that it's something that people can get caught up in terms of gambling all day, every day on the market. Next slide. So these are a little bit tricky to see, but I didn't want to skip them. From that educational perspective, after losing many times in a row, you're more likely to win. And the top graph is all gamblers. After losing many times in a row, you're more likely to win. If you didn't have a problem with gambling, you said yes to that 12%. 12% of folks said yes, and they were non-problem gamblers. And that way more than doubled to 29% for at-risk problem gamblers. And if you do some math, you find out that it's random, where the ball is going to land on the roulette wheel, whether the dice are going to come up on a 2 or on a 6. Those are random occurrences. And slot machines, video lottery terminals, they're also set randomly. But that doesn't mean that people don't have superstitions and believe after losing many times in a row, you're more likely to win. So for at-risk problem gamblers at 29%, there's a much higher superstition rate. The next statement there, you could win more if you used a certain system or strategy. 43% of at-risk problem gamblers believe that. 43%. In our state office tower, in our office, back when we used to go to an office, we had cafes, 3 different cafes within the State Department. And there were folks that would get their tickets and gamble. And many of them would be carrying a little notebook, or they'd have some kind of cheat sheet because they had a system. And they were sure that eventually that system was going to pay off. You could not dissuade them from their system. Something else that we've seen over time is the individual who wants to buy their ticket. If the drawing occurs at 7, they want to buy their ticket at 6:59 because there's some kind of power to that. And they believe that. At the bottom, you're looking at responses to that question based on only at-risk problem gamblers. So after losing many times in a row, you're more likely to win. If you look at in yellow, for all gamblers, that was 14%. This is the last column. For at-risk problem gamblers, that was 29%. So it's twice as high for at-risk problem gamblers. And again, when you look at using a system to win, 27% in yellow for all gamblers, 43% for at-risk problem gamblers. It's data, it's undeniable. So when you're working with clients, you need to know this. They do have, we're talking about cognitive behavioral therapy. How can you help your clients understand that they're creating these myths? We call them, basically when we're talking about gambling, these are myths. And if they can get past that, it'll help them get over, start to move towards recovery in terms of gambling addiction. Next slide. I'll share with you that I made these slides this weird tone, and then I could not put them back. So I'm sorry you're looking at some weird greenness, and then looks like I had a little accident on that top line. I couldn't make that go away either. So, hey, mea culpa. Do you remember a big win when you first started gambling? We've talked about that a lot. Under the yellow highlighting, obviously the highlighting didn't work the way it was supposed to on this, but circled in pink, do you remember a big win when you first started gambling? Top row, 57, almost 58% of individuals remembered a big win. 58%. And the big loss, that same category, 41% remembered that big loss. And then look over in the first column, among non-problem gamblers, it was 23% and 12%, much lower. And let's just jump down to the second graph. Among problem gamblers, those are the folks that would be likely diagnosable, almost 77% of them remember a big win, and 67% of them remember a big loss. So these were formative things that happened, formative events in their psyche. We don't know what the age of that was at this point. Next slide. Some of the other things that we looked at with the Ohio Gambling Survey. Income levels, painful event and urge to gamble. In other words, if something bad happened in your life, if you experienced a painful event, did you have an urge to gamble? We have the levels of that. The amounts gambled per game, depending on the type of gambling, how much somebody gambled. Average household incomes, whether someone believes that it's the community's responsibility to prevent gambling, to promote responsible gambling, whether the prevention works. That one was, do you believe that you can prevent problem gambling? And about 66% of individuals believe that you could prevent problem gambling, which was satisfyingly high. We asked about veteran status and religion. We do have breakouts on all of these. Most of those are so detailed that it's unlikely you're going to be able to use those in your work. But I would say if you would like to see what we have for your board area, we'd be happy to share that with you, or for at the state level. But it's a little bit harder to see trends within this. I just wanted you to see what all we had asked and analyzed for 2017. Next slide, we're going to look at youth data pretty quickly. And the next slide. So the Ohio Healthy Youth Environment Survey, this was the 16-17 data, comparable to our adult data set. How often did you gamble money or personal items? Almost 15% of these 12 to 17 or 12 to 18-year-olds said yes to that. Have you ever hidden money? Have you ever hidden your gambling from family or friends? Money you've won or lost? 1.7%. Lied to people about your gambling? A little over 1%. Have you ever gambled more than you planned? 4%. Or felt bad about the amount you bet and what happens when you bet? 3.4%. Those last two are actually part of the Canadian Problem Gambling Index. I mean, in a form, they are similar to those CPGI questions. So you can look at that. Between 3.5% and 4% of youth 12 to 18 years old are already on the at-risk problem gambling scale. Very concerning. Next slide. The rest of these youth data sets are from the 2020 student survey by youth in Southwest Ohio. And if you look at the italics there, 39,000 youth in Butler, Claremont, Hamilton, and Warren counties. 77 public and private schools participated. So This was the first time this question was used. It was piloted, and special thanks to Prevention First, who shared this data set with us. In the past 30 days, have you bet or gambled money or virtual currency or possessions in any of the following ways? Online internet, 5%, on apps, 5.3%, video gaming, 7.4%. So of the young people that took this, 39,000, 7.4% said that they had gambled in video games. So we may have thought that a lot of young people don't think they're gambling when they're gaming. This would beg to differ. They knew they were gambling within the video games. Next slide. And this is a very colorful, is really why this whole slide deck is so colorful. I had to go with this one. You can see here over the 4 years that these gambling questions have been asked, where the changes are occurring. Let me slide along to 1, 2, 3, 4 dice or coin flips. You see that hasn't changed a lot. The 4 bars for dice or coin flips are about the same. For card playing, for whatever reason, it dropped from 12% down to about 9% in most recent years. And then betting on horse or dog race, you see dramatic changes in the 4 years. 14 and 16, there was a lot of that. In the last 2 years, we're under 2%. Does that mean the kids are gambling in other ways? Does it mean that there was a strong crackdown on young people being able to go into a horse or dog track? It's hard to say. We can't prove one or the other at this point. Betting on games of personal skill, you see that going from about 3% to about 12% over the last 2 years. So a dramatic difference. Let's jump to the next slide. And here, it's just all laid out. Past 30 days gambling. Past 30 days gambling, bet on games of personal skill, 12% endorse that one. 12% of the young people, and then 8% playing dice or coin flips, 9.4% playing cards. And finally, just a few statements. 53% of the students in Southwest Ohio said they play often or a lot of video or computer games on an average school day. So that's a big chunk of their time for most, well, for 53%, a little over half the kids. 91.6% reported that their parents would feel it was wrong or very wrong for them to gamble anything of value, which is good, very good. And 8.4% of students said they, a lot or often in the past year, spend too much time playing video games and it's affecting their schoolwork or a test. Significant. Next slide. This one reminded me of Never Have I Ever. That's a different presentation. Have you ever felt bad about the amount you bet or about what happens when you bet money? We're looking at that 3.4%, keeping in mind that that is a criteria for at-risk problem gambling. You can see the next one has gone down more or less. And there it is. We'll keep going. Next slide, please. Why are we seeing some of the changes that we're seeing? Well, it could be this. These 3 things I saw in a gamer store about a year ago. I have the highlighting in green there, and I don't know if you can read it, but it says it's a clearance one, no, it's clearance price tag. Power Up members get 2 times the points for Pro, 3 times the points for Elite Pro. So the more you play, the more money you spend. You can either become a pro or an elite pro. You can get more stuff. Klepto cats, just klepto cats. I'm not saying necessarily that's gambling, but it's called klepto cats. And then the next one is a loot box, except this was one that you could actually buy in the gaming store. Are we normalizing gambling for young, very young kids and young adults? Although I don't think any of these would appeal to young adults. I think they're more in the young gaming range. Next slide, please. And again, normalizing. This is a can of Pringles. Yeah, I mean, I remember when I was little and we would send in box tops for some little piece of crap. Remember, I'm from Appalachia. So you would get something for the box tops. You did the work, you send it in. What Pringles is doing right now, and I also saw it on one of the boxes of cereal in my house, a special Gears 5 3-day boost to instantly up your skills in game. So you can get a free trial basically of this upping your skills thing. And then after it's over, they'll want you to spend money or spend your virtual currency in order to up your skills. The photo is my son, he's my oldest, and my grandson. They're gaming. It's Christmas Day. You can see the board games are sitting on the side. Nobody's paying any attention to them. And my son and grandson are gaming. Enough said about that. Next slide. Okay, how the data have been used. Next one, please. All right. So again, I'm not going to read all this to you. I did it in terms, sort of the continuum, except if you look in the blue shape there, our work with the gambling industry, we use that data around advocacy with them, around workforce training for the gambling industry, supporting patrons, the voluntary exclusion program, and staff training. And then going back up to the pink section, these are all ways that we use data in our prevention outreach efforts. The yellow gold for treatment, it helps with recruitment, with screening and assessment. It helps with clinical care decisions, specialized training of the field, and certainly integrated healthcare. And then in the lime green, recovery, outreach, stigma reduction, research, engagement, fellowship, peer support, advocacy. If we don't have data and we're talking about stigma reduction, it means so much less. But with data, I mean, it draws the picture. It tells the story before we have a chance to. Next slide, please. So these are some of the ways that your community may have used the data. Somewhere around the state, all of these were used, but I'd like to hear a little bit more from the folks on the webinar. And we have a poll asking, what has your community done with the Ohio Gambling Survey data? Please select all that apply. And I know you might not all be Ohio communities, and that's fine. But if you have survey data in other states and you're on, you could respond from that perspective. Derek, that's probably long enough. Oh, that's good. That's a lot. And I see 18% shows nothing as far as I know, which is, can we go back to the, thank you. Not surprising We are willing to work with any community, anytime, to help you do something locally, whether that be getting stuff together for a health fair, anything from a flyer to a display. Same thing with print marketing, newspaper ads. We will real quickly talk about the campaigns that we make available statewide so that you can use those within your communities. The data tells you where you might want to focus those outreach efforts with the campaigns. The data also informs the campaigns so that we know how to design our strategies. Some communities have done editorials, blogs, Facebook podcasts, and absolutely used in training for workforce development. Very good, thank you. While we're paused, I see that someone asked, are your surveys done by phone or online? Let me answer that part of the question first. The 2017 survey was 100% by phone. It was mostly cell phone, but we did do, I think it was 17 counties that had poor cell coverage and or a higher emphasis of, or a higher population of older adults. In 17 counties, we did some landlines. So there was a percentage of landlines done, but the vast majority of the survey were random digit dialing. We will not be able to do that again. As you all know, folks do not pick up their phone if they don't know the person, or if it says it's a robocall, and that's what, we had 24,000, almost 25,000 calls made to get our surveys. Okay, that's incorrect. We had almost 25,000 surveys completed. It took about 100,000, maybe more calls to get those surveys completed. Actually about 10 times, yeah. Many calls. So it would not be the best way. It would take us 2 years to get the calls we needed to get the surveys completed if we did it that way again. Are the youth surveys done in schools required by the Board of Education? I don't know that required is the right word. Generally, it's a district decision whether or not they want to participate. I know that's true for OYES, and I believe that's true for the survey done by Prevention First. A district can choose to do it or not. Whether that's the Board of Education or the superintendent's decision, there's a lot of outreach that goes into getting those districts to do the surveying. And is there problem gambling addiction education in high schools in Ohio? The answer is yes, sometimes. And that depends on the prevention community in a particular area. There is definitely problem gambling prevention education going on in a lot of communities because the preventionists are building it into the work that they're doing in the schools. Some people have put problem gambling into life skills and evidence-based training. Some people have put it into too good for drugs. We know that risky business and stacked deck, they're both evidence-based or promising practices. They've both been done in schools. So we can also help you figure out how to get that done if you need help in your communities with that. Going back to the slides, and we're getting close to the end here. Next slide, please. And next one. Okay, so digital marketing strategies, which are completely dependent on the data that we have. One of those is certainly using social media from a digital platform, and this is just an example of a Facebook post. It was done by the campaign. It's not saying, go take the quiz. What it is it doing is engaging the audience, helping the audience to get used to seeing this was the Before You Bet campaign. and it did a high level of outreach. And folks would look back the next day, and then they might get a message that says, someone you love gambling too much, go to the website, have them take the quiz, and so on. Next slide. We use the data from the survey to inform the focus populations that we look at as we decide our tactics, our strategies for the Before You Bet campaign, and now also with Change the Game. Next slide. The data allows digital marketing to choose precisely who gets the ads. It's very scary when you first learn about it, but you now click those cookies, emails, those cookie messages. When you go to a website, all of that data is saved, and it is built into being able to make sure that the person who gets your ad is the person who needs to get your ad. Next slide. This is called geofencing. The data tells us that most people have at-risk problem gambling because of sports gambling. So with geofencing, we were able to send ads to this is an old picture. Before You Bet, it was called Be the 95%, our original campaign. We sent those ads to people who were going into casinos and racinos, and also as they left casinos and racinos. We sent them to people going to and leaving ball games and bars. We were able to capture their device ID. Your cell phone has a code in it, an ID in it. And up to 30 days later, we would still be able to send individuals ads who had gone to a casino racino 2 Friday nights ago. You can also control it. So there were no more than 3 ads per person sent in a 30-day period. That's how much we can zero in on individuals who need this messaging. Next slide. Again, that device ID, you can look at this as a map that's showing Ohio pretty much in that lit up area. And here you can see how many individuals clicked on the ads. 93,000 impressions in Cleveland, 335 people clicked on them, and so on. Next slide. Okay, so looking ahead, and here I'd like you to use your chat as much as possible. If we can let some folks, unmute some folks if they'd like to talk, that would be fine too. What data would help you better serve Ohio adults and youth? What was missing from the 2017 Ohio Gambling Survey data set that you need to improve services? What data would help you do your jobs better? What was missing from what we did before that would help you improve services? And as I mentioned, we're not going to be able to call 150, 200,000 people and get 24,000 surveys completed. That'll never happen in 2022. So what are the best methods you've heard? We know it'll have to be multimodal in terms of doing the survey in 2022. What are your thoughts on that? Innovative ideas for how best to assess Ohio adults and youth in 2022. And I am opening it up to you.
And if you'd like to be unmuted, please raise your hand on your GoToWebinar control panel and I can unmute you here. Otherwise, you can also enter the information in the question section of your GoToWebinar control panel. And let's go. So Scott asks, when will the full 2017 report be distributed?
Yeah, the narrative version is still under construction. And I'm not, from a research perspective, I'm not sure why all of that takes that long. It took a while. It took a couple years Oh, it took several years in 2012, and apparently it's happening again for the 2017 information. We do have the slide decks to share with anyone. So if you want the statewide slide deck or your county board area slide deck, we'll be happy to share that with you. The narrative, all the work's being done to make it look nice, and I probably could send it out in a PDF if that was something somebody wanted. In a bad looking PDF, I'll say. Other questions, comments? You don't think we're missing any data that would help you do your jobs better? That would help you improve care or prevention outreach? I guess that's
And
good to know.
Heather says, in Maryland, we break out Asians and Native Americans separately because the populations are very different.
Okay. Very helpful.
And Elaine, oh, I'm sorry, go ahead, Stacey.
Oh, I see here from Angela, school focused programming ? We are working on a couple things, and that is to actually produce the modules that will easily be fitted into evidence-based programming. Our preventionists have heard many times over the years that the schools have no more time for anything else, but they do already have EVPs built into their class schedules. So in order to get any prevention of problem gambling built in, we probably need to blend it with the existing work that's being done in the schools. And we're trying to formalize that. And then the additional question was, a lot of clinicians are unaware of the gambling tendencies that are normalized among young kids. That's why we're doing this today. We build that into all of our workforce development sessions. Anyone who takes the stage 1 training will learn about how, first of all, that early big win can cause at-risk problem gambling as a person ages. But now with gaming having so much gambling within it, we are building that into all of our workforce development. And we try to get our training into all kinds of events, not just a gambling related event, but any like Addiction Studies Institute, for example, any other behavioral health training, we try to get this information there so that people can become aware. Thank you.
And it looks like Elaine has her hand raised. So Elaine, I will unmute you and then you should be able to ask your question. And Elaine, it shows that you're muted on your end. So if you just unmute yourself, then you should be able to ask your question. And she may have typed in her question as well. Elaine asks, is there a way to collect data directly from casinos and racinos?
Well, that's a good question. And I don't know, I mean, I think there is, but it's unlikely to happen. It would have to be connected to individuals' player cards. And we can look into that more, but to date anyway, we haven't gotten information from player cards. We have some data on the individuals in the voluntary exclusion program. If people are playing without a player card, then obviously there isn't any data to be able to describe that individual from a demographic standpoint. Good question. And do we evaluate data from the Ohio lottery? We don't know a lot about the individuals that play the lottery. It's only been a year since they've been able to use charge cards. And we have looked at, the lottery has looked at how often individuals are charging and how much they're charging. There is some data available there, and we've had some discussions around research projects in that space. So I think that is something, I mean, both of those pieces with the gambling industry, I think can be built out, can be developed over time. But we'd have to, it just needs more work. From Dominic, where would I find your information? I'm from Pennsylvania. Dominic, if you want to do a private chat with Derek and send your email address, we'll get you what you need. It's too complicated to explain as far as my website goes, I have to say.
And for other states, Problem Gambling Network of Ohio serves as the state affiliate to the National Council on Problem Gambling, and they've done data that is state specific as well. So if Pennsylvania hasn't conducted it, then hopefully it would be available through the National Council. And there are 35 state affiliates like Problem Gambling Network of Ohio throughout the country. So with Pennsylvania being one of those states that has an affiliate. So we can certainly help you make the connection.
Thank you. And I see Jess is asking about doing the surveys at the source, such as casinos and racinos. Absolutely the best place to find all types of gamblers. Not all gamblers are going to the casinos and racinos. It would just be a matter of those companies letting us do surveys there, and we could ask. It's a good point. We do work closely with Ohio's gambling industry, and I think that's gotten so much better over time. Started out very confrontational, I would be the first to admit, and it's more of a partnership now. Any other questions or comments?
Those are all the questions that we have so far. If you do have additional questions, it looks like we have a few minutes left. You can ask that in the question section of your GoToWebinar control panel, or you can raise your little virtual hand and we can manually unmute you. And this is a great time to pause for a little reminder that this session has been recorded and will be available on the Problem Gambling Network of Ohio YouTube channel within 24 hours or 48 hours, and certificates will be sent once we get notification from the Ohio credentialing boards for continuing education. Sheila has a question, and Sheila, I will go ahead and unmute you, so you should be able to ask your question.
Okay, I just typed it in the chat, but I didn't see a review on it. But one of the things we were thinking about in Summit County in Akron was having those gambling prevention messages in the looking at seeing how we can get those in doctors' offices on their education monitors. I think would be good.
I think that would be great, Sheila. If you can make that inroad, then we would love to share, with the rest of the community how you were able to accomplish that.
Okay, will do.
I haven't heard of anybody getting it done yet, but it certainly is a perfect place to do it.
Okay, thank you.
I see here from Amanda asking for more specific information on the suicide connection to problem gambling. We do have more detail on that, in terms of how often there's a suicidal ideation, the attempts, that number, and depending on what study you look at, anywhere from 21% to 32%. And then completion of suicide is in that higher, well, not the higher range, more around the 20% of individuals who complete suicide have problem gambling in their backgrounds. Obviously, there's a connection to depression and serious depression, and then life consequences in terms of, I remember an individual in Jefferson County who had gambled his children's college funds, taken out an extra mortgage, those kinds of things. And he went to a public park in the Steubenville area. So he would make a big mess at home. and he shot himself. It gets to be more, obviously, than a person can handle if they don't get help. And we only hear about that when it bubbles up to the media, unfortunately.
And there was a question from Ken. Ken, you should be muted, so go ahead with your question.
I'm just curious, the last question about, type your innovative ideas on how best to assess Ohio adults and youth gambling behaviors. It'll be interesting because, Stacy, when you talked about trying to get programs in the schools, going forward with all that's going on right now, it may even be more difficult because schools are talking about shorter days and rotating kids in and out. So that'll be something curious unless agencies can partner with the schools who may have identified high risk students, and the agency might run a group. That could be possibilities. We've actually worked that out with some of our schools in the area a while ago. And in the question about getting information into physician's office, it was only by accident, I guess you would say, that the physicians that I personally go to in our service area for many, many years know what I do. They've asked for my card. And believe it or not, I've actually had referrals from them, mainly depression and anxiety, not gambling yet. But I think if you have a relationship with the doctor and they know what you do, they might be more likely to put information in. But certainly that other idea would be something to think about, especially starting with your own personal physicians might give you a little more of an edge. I have a few doctors coming up. I'll let you know how that works.
Thanks, Ken. It's true with my own personal one. I've done some advocacy type work just in general. More from a broader behavioral health perspective, but that does make sense. Putting a foot in the door with somebody you know. Amanda, thank you for clarifying. That was a suggestion for 2022 to dig a little bit deeper on the suicide and problem gambling connection. Since we're just about out of time, the last slide, and Derek will send these slides out to everybody. My contact information is there. I will be eagerly awaiting all of your amazing ideas as to other suggestions that you have in terms of what we should be including, anything that we don't need. Frankly, the survey is at the point where if we add something, we will need to take something out. So that's something we'll work on. We have Dr. Matt Corser and Dr. Amanda Burke from the community that will help us design the 2022 survey, as well as a committee of folks. If you're interested in participating in that, you can let me know. And if you feel like there are data points missing that would really help you do your jobs better, please let me know that. Thank you so much for participating.
Thanks, everyone. Hope you all have a wonderful afternoon and look forward to the emails from me. As a reminder, in order to get that certificate, once the CEUs are approved, you are required to complete the evaluation. That evaluation will be brought up onto your screen as soon as we close out today, and will also be included within that follow-up email. If you have any questions or need additional information, feel free to contact Stacy and her friends at Department of Mental Health and Addiction Services, as well as Mike and me at ProblemGambling.org Ohio. Thanks again, and look forward to connecting with you soon. Bye, everyone.
Bye-bye.